Good morning, everyone. And today our topic is iron deficiency anemia. Now, what is iron deficiency anemia? As like in my previous lecture, we were talking about different causes of anemia. You can see whenever there is anemia, the first thing which we check is the MCV. And I discussed yesterday high MCV, normal MCV, or macrocytic, normocytic, and microcytic anemia. And in microcytic anemia, the most important cause is iron deficiency. And the second cause after iron deficiency anemia is thalassemia. So, of course, when the MCV comes back as low, the first thing we go for is iron studies, and so that we would know like if there is iron is less in the body, uh, or ferritin is less in the body. We label them as iron deficiency anemia. And if, for example, the iron studies come back as normal, then we go to the second important cause, which is thalassemia. So, which we will discuss later on. So, deficiency anemia, as I was telling you yesterday, it is like microcytic type of anemia or microcytic hypochromic. Hypochromic means what? Like the color of the cell, the cells become pale because of less hemoglobin in the cells. So, to understand iron deficiency anemia in good detail, we must know how much is the iron requirements in the human body. So, basically, in developed countries, what the people take, is like it is calculated as EAR, or estimated average requirement of different things. Okay, so the estimated average requirement for the women's is higher for iron than the males. For example, in the women's, the average daily requirement for iron is around 8 milligram per day for females, and 6 milligram per day for males. Okay, so this is the estimated daily requirement, estimated average requirement, you can say, for the males and females. Okay, for babies, of course, this is different. Like for children age 1 to 3 years of age, it is around 7 milligram per day. So of course, like, and in the pregnancy, of course, the requirements are higher. Like for example, in pregnancy, the daily requirement for iron can go up to 27 milligram per day, which is quite higher than what is required per day for the females, because pregnancy, uh, there is a huge requirement for almost everything, not just iron. So um, basically, like, on an average, you can say the daily intake. Okay, now this average daily requirement is basically different than what we take daily. So in developed countries, like the normal, or the average, you can say average daily intake for iron in diet is higher, like is around 10 to 20 milligram. Okay, like this is what average, on an average, people take daily. So why? Because um whatever we take in the diet, not all the iron is absorbed. Rather, you can say the absorption is quite less. Okay, than what we take daily. So, or you can say like 5 to 10% of what we take daily is the one which is absorbed. And the absorption of the iron is increased when we take vitamin C or citric acid, and it is reduced when you take tea, or you are taking some other things like dietary calcium, the absorption of the iron is reduced. So what happens is, basically whatever iron we take every day is absorbed from the diet. Okay, so this one, like as you can see, like dietary iron is coming in the lumen, and this one is absorbed here. So basically, this one is called as Fe3 plus, is called as ferric iron. Okay, and like how it is absorbed from the body is like a complicated process, a complex process, uh, like how it is going to absorb in the body. So the absorption of the iron occurs in duodenum. Okay, and like many conditions, for example, celiac disease or inflammatory bowel diseases, where there is some like problem in the initial part of the small intestine, the duodenum, the absorption of the iron cannot occur. So there are higher chances, like the people who have IBDs or celiac disease, they have malabsorption of the iron. So um, basically, once the iron is absorbed from the GIT, it enters into the blood, and in the blood or in the circulation, the iron is bound to transferrin. Okay, so transferrin is the one, as the name shows, transferrin is the one which transport iron from in the blood to, you can say, different parts or storage pools in the hepatocytes or in the macrophages or in the RBCs. So it is transferred by the help of transferrin. So now, macrophages, hepatocytes, here they are showing, or RBCs precursors. Okay, they are showing over here. So now there is here you can see, they have given like this is transferrin. So see, this one is transferring, and this one is like hemosiderin. Uh, there is a thing called as what is hemosiderin? Hemosiderin is basically, you can say, uh, concentrated part of the iron. Okay, which is present in the blood. So there is a hormone which is called as hepcidin. So hepcidin is a hormone which is produced by hepatocytes. Okay, hepatocytes produce that, and it basically regulates the systemic iron levels. Okay, so it binds to a iron exporter called as ferroportin. Okay, ferroportin, and it is the one which is degrading that. Okay, and because of that, uh, this is how it is regulated simply. uh, like hepcidin production is increased in states of iron overload, so like which inhibit, you can say, additional iron absorption. Okay, whereas it is decreased in states, for example, when there is more and more erythropoiesis. So this is how, it controls the iron absorption in the intestines. So simply, what happens is, like once this ferric iron Fe3 plus is reached, you can say, in different parts of the body. Okay, it is complexed with a protein called as apoferritin. Okay, so this apoferritin, or like this one, is the main storage form of the iron in the form of ferritin. Okay, so iron in the stored form is called as ferritin. So now, uh, small quantities of ferritin is present in the plasma as well. Okay, but like most of the ferritin is in stored form. Simply, like you can see here, ferritin, and this one is stored in the liver. Okay, so like this is how the iron is regulated. So like we take iron in dietary form, and see, you can see over here, Fe3 plus ferritin, ferric iron is converted into ferrous iron Fe2 plus, which is taken up by the enterocytes, and here that one is converted into ferritin stored in enterocytes. uh, like if it is transported out of erythrocytes, it is taken in the blood, and it is transferred in the form of transferrin to different parts like hepatocytes, macrophages. Some of the iron is combined with the hemoglobin, like in the RBCs, circulating in the blood in the form of RBCs as well. So ferritin is the stored form of iron. Okay, and now the important thing to mention here is um, what happens in iron deficiency anemia is the iron stores, or you can say the ferritin in the body is get decreased. You can see over here, um, okay, like this one is like what the iron compounds in the body, like how much iron is there per kilogram in the body. Okay, so now the important thing to like which we are going to cover today is iron deficiency anemia. Okay, it is the most common type of anemia, and the etiology of iron deficiency anemia can be anything. For example, it could be increased demand, as well as it could be decreased supply, or the third condition can be increased losses. Okay, so simply like these are the three main you can say ways by which there is the deficiency of iron in the body can occur. So what are the things, for example, which can cause increased demand? A very nice example of that one is uh, pregnancy. Okay, so pregnancy is a condition or is a state in which as I told you, the requirement can go up to 27 milligram per kilogram, right? 27 milligram per day. Okay, like it can reach up to that much. So of course, like in pregnancy, there is increased demand of the iron, and when the women's, when they are pregnant and they are not taking enough iron, so it can lead to iron deficiency anemia. The other thing is decreased supply, and in the decreased supply, of course, the most important factor in developing world is uh, diet, okay, or the dietary factor. So like in pediatrics, as you know, we were discussing that the babies who are completely fed on cow milk. So cow milk is not good in iron, so we must provide them with some iron fortified cereals, or we must add iron in their diet. And if we will not provide that, they can develop anemia. And a very important cause of anemia in infants, or not just infants, like even in toddlers. So simply all the babies who are fed on cow milk, and you're not providing them with any extra iron, they can develop iron deficiency anemia. So this one is one of the cause. So diet, like of course there can be many causes, like many deficiencies in diet which can lead to iron deficiency anemia. So cow milk, any baby who is consuming cow milk completely without any other thing, so they can develop and other things, like for example the people who are not taking diet which is like rich in iron, of course, like it can lead to this thing. I'm going to show you uh, like there's a list of diet which you can found, like which is what you can say not iron rich. One thing, like a word which many elderly people can take, which is called as tea and toast. Many elderly people, when they don't have good teeth and they are weak, so they cannot chew many of the things like meat, for example. So they can develop iron deficiency anemia easily. Okay, so for example, you can say um, uh, like or for example, like, decreased supply can be come in this category. For example, someone who have some duodenal conditions like celiac disease or inflammatory bowel syndrome, in which they are taking enough amount of iron, but their intestines are not absorbing that. So when their intestines are not absorbing that, so for sure, like, uh, they can lead to it can lead to iron deficiency anemia, because whatever diet you will take, either it's rich in iron or either it's not rich in iron. So what is going to happen? Your body is not going to your intestine is not going to absorb that anyways. So what will happen, that it is going to lead to uh, iron deficiency anemia. So like any of the causes, of course, like there are different causes in developing world as well as different causes in developed world. So like decreased supply is simply either you are taking less in diet, or either like whatever you are taking, of course you cannot uh, absorb that. Okay. So like of course in developed world, this is not the case, because over there, that the like most of the people, they have access to good diet. And like as in the start I told you, for example, someone who is taking too much tea, or someone who is taking bran or calcium over a long period of time, it decrease the iron absorption from the body, from the intestines. Okay. So this thing can occur. So diet plays a very important role, and in the babies, like that one is very very important to know. There are other conditions as well. For example, many people who are undergone surgery like gastrectomy. So in gastrectomy, because that part of the intestine is resected, which is the one which is dealing with the iron absorption, so they may have this iron deficiency anemia. So gastrectomy, inflammatory bowel disease, and as well as celiac disease, very important, guys. Okay, celiac disease can all lead to decreased supply, because your body is not absorbing. The last one is increased losses. Increased losses, remember one very important thing, that the females, they lose blood every, like, in menstrual cycle. So some of the females, they have increased amount of menses. So we call that condition as menorrhagia. Okay. So menorrhagia is one of the example of increased losses, as well as in developed world. For example, many of the elderly people, they may have iron deficiency anemia, and one of the reason of developing that iron deficiency in anemia is because they have some sort of cancers, not just cancers, but like other conditions like peptic ulcers. Okay. So what happens is, in peptic ulcer disease, okay, peptic ulcer disease, or what you can say in cancers, especially GIT cancers. Okay, there is loss of small amount of blood on daily basis, and because of this small amount of blood loss on a daily basis, what happens is, uh, like of course the loss is so much minute or small that it doesn't change the color of the stools, but you like they are losing blood every day. So chronically they can have iron deficiency anemia, and that's the reason, like when some adults, they come with iron deficiency anemia, one of the investigation we can do in them is called as colonoscopy, just to see their see their intestines, either they are having any carcinoma, or we can do fecal occult blood test, like to check their feces if they have any presence of blood or not. So we can do this thing. So this is like the example of increased losses when someone is losing blood on daily basis. Okay, so it can lead to what you can say iron deficiency anemia. Not just this one, like for example, someone have a recent GIT bleed. Okay, so like they are the one, they are going to lose a lot of blood at once, which can lead to uh, iron deficiency anemia. Okay. Other conditions which can, in which what you can say, you can lose blood on daily basis. um, One of the condition is, the people who have cardiac valve replacement done. Okay, so especially when the people, they have cardiac valve is replaced, and they are having what you can say some sort of metallic valve. So what happened is, like, the RBCs, they strike on that metal, and they keep on bursting. So when they keep on bursting, like, the patients, they lose iron, the RBCs, on daily basis. And when they lose iron on daily basis, it can lead to iron deficiency anemia. So these are all the causes, you can say, by which they can develop iron deficiency anemia. Uh, One more thing which is there, but mostly in developing countries, many of the parasitic diseases, like, sometimes, the parasites, or we call them as helminths. Okay, they are the one which basically uh, invade or infest the intestines. Okay, so these parasites can lead to iron deficiency anemia. There are many one, uh, many, what you can say, parasites or helminths which can cause this thing. And that's one of the reasons that, when, for example, any babies, they come with iron deficiency in anemia, and on history you could not found, like, this is the diet which is playing the role. So what we give them is uh, anti-amoebic drugs or anti-parasitic drugs, albendazole or mebendazole, to deworm them. So basically, these are the worms, or, of course, which we call them, which are called as parasites. Okay, or parasitic worms, which are which can infest the uh, intestines. Okay, helminths. So these are the one which can infest the intestines. Okay, so, and can lead to iron deficiency anemia. So ankylostoma and nectar americanus, so there are different, what you can say, worms. So we deworm these patients. We give them albendazole or mebendazole, to kill, like, to kill these parasitic worms in them. So all these things can cause iron deficiency anemia. One of the cause can be, like, repeated blood donations as well, though it is very, very, very rare type of thing. Okay, so now, uh, like, once we know what is the etiology of iron deficiency anemia, we can go on to, like, here you can see, insufficient storage iron in fetus, insufficient intake of iron, rapid growth, faulty or incomplete iron absorption, excessive loss of iron. So, like, I also classify them in the same way. Okay, so now, what happens is, uh, the clinical features of iron deficiency anemia. As I was discussing yesterday, that, some of the features are combined features. For example, all the people who have anemia, they have pallor, they have fatigue, they have weakness, they have dizziness, they have shortness of breath. They may have shortness of breath. They may experience palpitations. Okay, so these are the features, which are the features of all the anemias, which I already discussed yesterday. So now, the features which are more typical to iron deficiency anemia, you have to remember few of the things. One thing is this one, chylonychia. Okay, so what is chylonychia? They, like, basically, the patients who have iron deficiency anemia, their nails become brittle. Okay, and their nails become spoon shaped. So we call this condition as chylonychia. See, so they have brittle nails as well as spoon shaped nails. Okay, this is one of the sign of iron deficiency anemia. Their hairs also become brittle. So they have brittle hairs, brittle nails, and spoon-shaped nails. We call this condition as iron deficiency anemia. Other features which like the patients may display is irritability. Many of these patients they develop what you can say uh, restless leg syndrome. Restless leg syndrome. Okay, so now not so common, but and not maybe like nowadays you will not see these kind of things in patients. But one of the thing which they may have, which they may show, is dysphagia. Okay, and what is this dysphagia? Dysphagia developed is like because of the esophageal web is there. So there is one thing which can be mentioned here is there is something called as Plummer Vinson syndrome. Okay, so this is a syndrome which is associated with iron deficiency anemia. What are the features they show is dysphagia due to esophageal web. Then they show glossitis, okay, and they show stomatitis, okay, and they have iron deficiency anemia. So like all these features together is called as Plummer-Vinson syndrome. Okay, they have dysphagia due to esophageal webs. Okay, and they develop glossitis as well as stomatitis, and they have iron deficiency anemia. Like together, all of these we call them as Plummer-Vinson syndrome. So now see one more thing which in the babies can occur is called as uh, pica. Okay, so what is this pica is? It is basically consuming non-nutritious things, for example wood, paint, like the dirt from the floors, okay, eating sand, things like this. So these are the children who basically show appetite to what you can say non-nutritious substances or non-food substances. Okay, we call this condition as pica. Okay, so any children who are displaying this pica, like they started consuming the things which are non-nutritious or which are not food, for example wood, uh, dirt, paints, and things like this, we call this thing as pica. So always think about iron deficiency anemia in these patients. Now, how we investigate the patients who have iron deficiency anemia. See, iron is stored in the body in the form of ferritin, as I already told you, and iron is transported in the body by the help of a protein called as transferrin. Okay, so both of these things are very important in diagnosing iron deficiency anemia. So the thing will go in this way. I can show you how to diagnose the patient of iron deficiency anemia. Will go in this way. Uh, diagnosis of wait. Diagnosis of uh, iron deficiency anemia. So what happens is, first of all, what we do is we check the patients for we check we send the patient for CBC, right? Of course, like this is the first step as we discussed yesterday. So once we found in the CBC like the RBC level is low, the hemoglobin is low, and the patient have the symptoms of iron deficiency anemia. So what we check is we check MCV. When the MCV come back as low and the MCH mean corpuscular hemoglobin is low, or simply it's a microcytic hypochromic type of anemia, then the first step is like we send the patient for iron studies. Okay, so in the iron studies, we don't check the level of iron in the body. Why? Because the level of the iron in the body can change according to the diet you have taken. For example, someone who have iron deficiency anemia and he have taken iron rich food today, so what will happen when you are going to take the blood sample? So based on if the patient have consumed a iron rich diet now, what will happen, maybe the iron level will become normal, will come back as normal, so which can be misleading. So that's why what we check is ferritin level, okay, which is basically the storage form of iron. So if someone have low ferritin level, you can see over here, you can see over here patient with microcytic anemia. So we check the ferritin level. Uh, if the ferritin level is less than 45 microgram per milliliter, okay, so think about what you can say, iron deficiency anemia, okay. But it is not always the case, because sometimes the level come back as 46 to 99. Then we have to check the other indicators for iron deficiency anemia. But if the ferritin level are coming back as 100, more than 100 microgram per liter per milliliter, of course there is no like iron deficiency anemia can be ruled out. So we check the ferritin levels, okay, and ferritin levels, if they are very low, they are the diagnosis of iron deficiency anemia. But there is one issue in this thing. What is the issue? That ferritin is also a acute phase reactant. What is acute phase reactant? Whenever in the body there is some inflammation, inflammation is there, so in the body there are certain things which get raised. For example, CRP, C-reactive protein. Whenever there is any inflammation in the body, CRP levels goes up. So ferritin is an acute phase reactant. So whenever in the body there is some sort of inflammation, the ferritin levels go high. So remember, guys, that as it is an acute phase reactant and it can be elevated in the settings of inflammatory condition and liver diseases, for example. So it can mislead you in diagnosis of iron deficiency anemia if there is inflammation. So now, if anyone has have ferritin level is too much low, diagnosis is done. If the ferritin level come back in the level of 46 to 99 microgram per milliliter, of course you must start thinking about, you must check the other things as well. So then we go for other studies. Now, see, there is one thing which is called as total iron binding capacity. Okay, so what is it? Is this one is total iron binding capacity. So when the iron level in the body is less, like first of all, I think I must tell you what it is. Okay, total iron binding capacity can be taken in this way. You can see over here. See, this is the transporter, transferrin, okay? It have place for the iron. For example, on this transferrin, for example, I'm just giving an example, 5 irons can sit together. So what happens, for example, when the iron level in the body is good, okay, what you will be finding that out of 5, 4 iron will be transporting on this, okay. So the total iron binding capacity in this case will be less, okay. But in case like the iron level in the body is not good, so when we will check the level of total iron body binding capacity, we will found that at some time just two irons are sitting on this one. So what will happen, that there is three seats which are still there. So in that case, the total iron binding capacity in the body will be raised. Okay, so like, listen to it carefully. When the total iron binding capacity is raised, it means more iron can, like this transferrin can accommodate more iron, which means that when the iron stored in the body is less, the total iron binding capacity in the body will be high. But for example, if the iron is enough in the body, so more like there will be more iron on the transferrin. So what will happen, that in when the body iron in the body is enough, so total iron binding capacity will go down. So simply, total iron binding capacity will be higher when the iron is less in the body. Okay, so total iron binding capacity will be higher. Simply, when the ferritin level come back in this level, we check the other things. If the total iron binding capacity is high, serum iron is less, and the saturation is less, we again say that the patient have iron deficiency anemia. But if the total iron binding capacity is low, which means like the transferrin or there is less capacity of iron in the body, okay, or the serum iron is high or the saturation is high, there is no iron deficiency anemia. One thing which I would like to talk about is basically this one, which is soluble transferrin receptors. Okay, so what happens is in the body, um, like when in the body, wait, let me check if there is any explanation for this thing over here so that you can understand this thing better. Soluble transferrin factors, like just I'm just checking, guys. Okay, I was just like searching if there is anything like this. Okay, what happens in case, okay, this investigation is not ordered routinely, but in very, what you can say, um, rare cases, maybe we need these type of investigations. So what happened, guys, is sometimes like it's hard to diagnose. Okay, most of the time, it's very easy thing. A patient came and what you get is like you found the signs of anemia, the patient has symptoms of anemia, you order CBC, you found MCV is less, it is microcytic, you found MCH is less, it means like it is hypochromic. So you order iron studies, and what you found is there is less iron, less ferritin, increased total iron binding capacity, decreased saturation. Okay, the diagnosis is done. Okay, but there are okay, you found that there is less MCV, there is less MCH, but the ferritin level in the body is good, as well as see the total iron binding capacity is less or the serum iron is more. So of course, like there is no iron deficiency anemia. We must search for the other causes. For example, a patient came, you found that the patient have hypochromic microcytic anemia. You check the ferritin level, which comes back in this value. Now you know that in inflammatory conditions, because ferritin is an acute phase reactant, so the level of this one can be higher, can show you, can give you the wrong picture. You started looking for these things. Still, for example, you are confused, either it is total, like it is iron deficiency anemia, or it is some other condition. We order this test, that is soluble transferrin receptors. So what happens, by the way, to tell you what happens in these patients is that sometimes, what you can say, when there is less iron stores, less ferritin. So what the body response to this condition is that it keep on making transferrin receptors. Okay, so like what this soluble transferrin receptors is, basically it reflects the availability of iron at the tissue level. Okay, so these receptors are expressed on the surface of erythroblast. Okay, and these receptors are basically responsible for the iron uptake. Okay, so the body will keep on making more and more and more soluble transferrin receptors. Okay, and if the soluble transferrin receptors is higher, what it means that the body is making or expressing more and more transferrin receptors on the erythroblast or on the cells, so that it should take more and uptake more and more and more iron. So if someone is confused in making the diagnosis of iron deficiency anemia, we can go to check for soluble transferrin receptors. If they come back as higher, which means that the availability of iron is not good at the tissue level, so that's the reason the body is making more and more receptors so that more and more iron should be uptaken. It means that the iron stores in the body is not good. So we check soluble transferrin receptors. If they come back as higher, it means that the patient have iron deficiency anemia. But if they come back as low, it means that there is no iron deficiency anemia. Okay, so in iron deficient states, more transferrin receptors are expressed so that there should be more iron uptake. There should be more receptors which can uptake iron. So this one is very what you can say a helpful test in the settings of inflammatory conditions. Okay, see, a rheumatoid arthritis is a chronic condition in which the patients are taking NSAIDs for their pain. Now NSAIDs can cause peptic ulcer disease, ulcers. They can lose a lot of blood on daily basis. They can develop iron deficiency anemia. Now rheumatoid arthritis is an inflammatory condition, which means in inflammatory condition all the acute phase reactants will go high, so ferritin will go high. So in them maybe there is a chances that you can get confused, either it's iron deficiency anemia or not. Then in that settings of inflammatory conditions we can depend on these receptors, which are called as soluble transferrin receptors. So in those conditions, if they are coming back as higher, it is iron deficiency anemia. If they are coming back as lower, there is no iron deficiency anemia. Okay, I hope you understand. So guys, remember this thing. Like quickly, I'm going to revise this thing because I think like many of you guys can get confused. CBC, I think we have discussed it many times. Iron studies, which can give you the level of iron. Okay, I should add it here. It can give you the level of iron. I told you this iron levels can vary, or it varies on your daily diet. Okay, so we cannot depend on that. If you are taking iron rich diet today, iron level will go up. If you have taken less iron today, so maybe it is going to go down. So we cannot depend what you can say on this test. Okay, because and all the serum iron is bounded with transferrin. Okay, so that's why we go for ferritin. And ferritin is a very important test because ferritin shows the body stores. Okay, in the start I show you that one, that the iron is stored in the body in the form of ferritin. So this one is the body storage form. Okay, so but it is also acute phase reactant. So that's why in case of inflammation, infections, malignancies, what will happen, that it is going to go up. Then we can check the total iron binding capacity. Okay, so this one is simply like normally 1/3 of the transferrin is saturated with iron. So when the iron is less, the total iron binding capacity will go higher, more. When the iron is more, total iron binding capacity will be less. Okay, And then we can do what? We can do saturation or saturation of iron, okay, of iron. Okay, so we can do this thing. I'm talking about this saturation. Okay, so this saturation will tell us how much body is saturated with iron. And the other test which we can do, like which I told you, is called as soluble transferrin receptors. Okay, so as I told you, it reflects, I will write overhead, it reflects the availability of iron at tissue level. Okay, it reflects the availability of iron at tissue level. So whenever there is some chronic inflammatory condition, whenever you are suspecting some malignancy, some infection in which you cannot trust this one, and the results come back somewhere there, then we largely depend on this thing. So simply, when the body storage is, when the body iron levels are less, there are more and more soluble transferrin receptors are expressed on the cells, so that they can uptake more and more iron, and we can check their levels in the blood. So whenever this one come back as higher, it means the body is hungry for more and more iron, which means iron deficiency anemia. But if this one is like less, it means no iron deficiency anemia. So guys, this is the best, you can say, picture to like for the diagnosis of iron deficiency anemia. You can see over here, we can check the ferritin level. Either we can make our diagnosis of iron deficiency anemia, or either we can rule out iron deficiency anemia. But whenever we are confused, the ferritin levels are not guiding us, then we depend on the other test. And when even these tests are not helpful, or there is inflammation, infection, or malignancies, we order this test. Okay, soluble transferrin receptors. So I think like this one was the most difficult part of iron deficiency anemia. Okay, because on the like pre-medical basis, when we study iron deficiency anemia, they just tell us completely simply, iron level is less, ferritin level is less, iron deficiency anemia. But sometimes in medicine, in inflammatory conditions, it can create trouble, so we can go order for this test. Once the diagnosis of iron deficiency anemia is done, this is how it looks like, on microscopic view. And what you can say, once the diagnosis of iron deficiency anemia is done, then of course we can go on to, what you can say, the treatment. Okay, see this one. As I was discussing this thing, that iron deficiency anemia, we will do all these tests. Okay, and these will be the things which we are going to get. Okay, see, serum iron is less, total iron binding capacity is more, saturation is less. Okay, ferritin, what you can say, FEP, I don't know what this one here they have written. Okay, so anyhow, total iron binding capacity is more, and you found that the receptors are also expressed more, so it is iron deficiency anemia. But whenever, for example, the iron studies come back as normal, then we check the patient for thalassemia. Anyhow, let's go further and talk about the treatment. Okay, so treatment of iron, what you can say, treatment of iron deficiency anemia can be done, of course, like if you found any underlying cause, so treat that. Okay, wait. So if you found any underlying problem, you found that there is some problem with the diet, treat that. If you found a bleeding source, treat that. If you found any other problem, like you found that the patient has celiac disease, treat that. Okay. Second step is, of course, supplementation. Okay. We supplement, we give iron in supplement form. So guys, iron is available in syrups, in tablets, okay, as well as in IV form. So what we give the patient is, uh, We ask them, first of all, we educate them. We ask them, like, about the diet, what kind of diet, like they should be taking iron rich diet. Okay, so if like they are taking that diet, that is addition. But if the iron level is too much less, we give them ferrous sulfate. Okay, uh, like the tablet or syrup form. So we give them this ferrous sulfate, we can give them ferrous gluconate, we can give them ferrous fumarate, all the supplement like iron tablets, syrups, or like IV, of course, in extreme cases, we can use that. We give them. Okay, so what we tell them that whenever they take iron in tablet forms, what happens is that it can cause constipation as well as so it causes constipation as well as it makes the stools looks black. Okay, they turn the stools blackish. So we always tell them this thing, to the patient, that it is going to cause constipation, it is going to change the color of the stools. Okay, so we keep on giving them iron tablets on daily basis. Okay, we ask them, so like we ask them to take them on daily basis. Okay, until their anemia is gone. We keep on checking their CBC levels every month. Okay, so once we found that their CBC level or their HB level is normal, we have to continue. The very important point, by the way, we have to continue the treatment for another 3 months. Okay, like why? Because what's the reason behind that is simply because we just don't want to bring the level of HB to the normal values, but rather there is one more thing which we have to do. We have to uh, like replenish the iron stores in the body. Okay, so our target is not just to bring this the level of HB to the normal values, but rather also to bring back or full like uh, make their iron stores in the body to the normal to the normal values. Okay, so this thing is important. If anyone, of course, they cannot take oral tablets or they cannot take syrups, uh, then of course we can go for IV treatment. Okay, IV treatment as well. So like normally it takes like around 1 week, like the reticulocyte count started increasing. Okay, and the hemoglobin, it normalized by 10 gram per liter per week. This is the, if there is no ongoing blood loss, this is the rate how it corrects the level of iron in the body. Okay, so simply they keep on we keep on giving them this. Okay, and we keep on checking what you can say their iron level every week or every month, depending on how you are going to monitor them. So the best way is to take iron tablets, in an empty stomach. Okay, uh, by with like we ask them to take some you can say some citrus juices like vitamin C, which increases the absorption of iron in the body. Okay, so and like of course, like you don't have to remember the values, like how much iron should be given. Okay, what is the value? But the value of iron which we give them is like 325 milligram of ferrous sulfate 4 times a day, or 3 times a day can be given as well. Okay, so this is how we can we can provide them with iron. Okay, and of course, like monitoring is very important. Always tell them the side effects, always tell them that it is going to change the color of their stools. This is very important, guys. Okay, uh, nowadays there is some extended release tablets are also available, which causes less constipation. Okay, sometimes it needs around 3 to 6 months of treatment to bring back the iron stores of the body and to bring back the HB at normal level. Okay, so this thing is important. Some of the patients, like you found that they don't have like their HB is not coming back as normal. Their tests are not coming back as normal. So what can be the reasons for that? So simply, what are the failure to correct the uh, iron deficiency anemia? It could be poor compliance. Maybe the patient is not taking the tablets normally, properly. Maybe it is improper administration. Maybe they are not taking it as you are instructed, or maybe they are consuming some sort of diet which is uh, creating problem with the iron absorption. Okay, either the patient is having some malabsorption like celiac disease or inflammatory bowel disease, or either there is some ongoing blood loss. So of course you have to investigate them more. Or maybe you did not make a correct diagnosis of IDA. Maybe the patient is having some sort other type of microcytic anemia like thalassemia. Okay, so these things are there. This is the same thing, guys, which I already explained you. Ascorbic acid is vitamin C, we can take. Okay, blood transfusion, of course, for very very severe anemia, we can give them blood transfusion. Okay, so ask them to take more meat, more eggs, more fortified uh, cereals in case it's an infant, and consume more green vegetables. So simply, education is very important in this one. For example, if it's a baby, especially, so we always educate them, that we tell them, cow milk is have don't have good amount of iron. So always provide your kids with uh, iron fortified rich formulas or cereals which are available in the market. Or in many of the developing countries, diet is the main problem. Poor people, they cannot have access to iron rich diet or good protein diet. Of course, like they cannot have access to meat or eggs, or good quality iron diet. So of course there are different issues at different parts of the world. So guys, like how we can prevent that? Of course, like prevent iron deficiency anemia, of course, by you can say education, providing good diet to all the people, and also to by educating them. So rest is like, if there is some sort of pathology, of course you have to clear that. You have to what you can say, provide them with, like, we have to investigate them. Either, for example, they have some sort of carcinoma. Okay, yes, in investigation part, sorry, I did not talk that time about this thing. I feel really sleepy today, so maybe you will have a lot of yawning, during the lecture. So diagnosis of iron deficiency in anemia, once the diagnosis is done, then you have to look for underlying causes as well. Okay, especially in the elderly. So for that, depending on, of course, in history, you will ask for if there is they have any mechanical wall, for example. So maybe the anemia is due to that. Of course, in that case, you don't have to do much, brother. You just have to provide them with what you can say, iron tablets to um, like give them their stores back and ask them to improve the diet. Okay, we can do colonoscopy. Okay, to look for what you can say, any carcinoma in the intestine, in the colon, which is like, why I'm saying colon carcinoma again and again. Colon carcinoma is very common. Okay, in elderly. So there's one test called as fecal or occult blood test. What they do is, like, they take the feces, okay, stools, and they check like either there is blood present in that or not. If the patient is having peptic ulcer disease, of course you must stop them for taking any more NSAIDs and treat that, because the patients can lose blood on the that as well. There are other causes of losing blood, guys. Angiodysplasias are there, polyps are there. Sometimes there is AV malformations are there, but of course, like, rare causes, not so important causes. So anyhow, like, that's all about iron deficiency anemia. Like, I was planning to finish iron deficiency anemia as well as megaloblastic anemia in one go, but it took like around 1 hour just to finish this thing. Iron deficiency anemia is very, very, very important topic. Why? Because it is very, very, very common in this world. Okay, it is said like around 10% of this world population is having what you can say iron deficiency anemia. Of course, females more than males. Okay, and especially kids or children. Who are aged between 1 to 3 years of age, or who are the one which are taking cow milk, who are consuming cow milk a lot. So we must improve their diets. Okay, so a lot of pregnant females, they have this anemia, especially the females who have multiple pregnancies. Okay, and they have less gaps in the pregnancy, especially the developing countries where the women have like many, many, many children. Countries like Pakistan, India, they have what you can say increased chances of having iron deficiency anemia. Okay, so thank you so much, guys, for listening to this lecture.